Technical Veterinary Learning TVL channel, founded and produced by Professor Ahmed Mamdouh El Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University. Prevention and control of animal infectious diseases caused by toxins of different Clostridium species. Put the disease prevention first. In the animal field, the difficult task is how can clostridial diseases be prevented? This task is very tough for veterinarians and animal owners. So, this prevented through primary defense against clostridial diseases is vaccination. Good vaccination greatly reduces the occurrence of different clostridial diseases. Young animals from vaccinated dams are also protected. Number 4. Managing stress factors such as handling, drenching, shearing, and other disease management can all help in the prevention of clostridial diseases. Number 5. Care should also always be taken when moving livestock from one feed to another, as this can be a major risk factor. Number 6. Many vaccines are broad spectrum and cover a variety of different species of Clostridia, so we should always select the most appropriate vaccine based on local conditions and the prevalence of these diseases in the area. The principles of immunity. Number 1. Passive immunity is transferred from the mother to the offspring in the first milk stream, the colostrum. Number 2. If the mother is boosted with vaccine about 1 month before the offspring is due to born, the level of protection and period of time for which the young animal is protected is increased. Number 3. Active immunity requires a primary course of 2 doses of vaccine for 2 to 6 weeks about to give reasonable period of protection. Number 4. The first dose only primes the animal immune system. Hence, the need for the second dose is very important. Number 5. The first dose is usually given at marketing time when the protection from the mother's milk is starting to decline. Number 6. Annual boosters are required to maintain the protection, as well as providing antibodies in the colostrum to protect the young until they are old enough to be vaccinated. Number 7. Boosters should be given strategically before high-risk periods. Prevention done by clostridial vaccines which protect sheep and other animals against multiple clostridial diseases have been available since the 1915s. Clostridial vaccines can contain antitoxins to 1 or more endotoxins produced by the following bacteria: Clostridium shovii, Clostridium hemolyticum, Clostridium novii, Clostridium perfringens, Clostridium septicum, Clostridium sordelli, and Clostridium tetani. For breeding ruminants, given 4 to 6 weeks apart, followed by an annual booster 4 to 6 weeks before lambing, or calving no longer than 12 months apart, require a primary course of 2 injections of an appropriate clostridial vaccine as present in the region. This is the shape of ultra-PAG vaccine. This is the shape of Covaxin 8. This is a picture of Covaxin 10. Abbasiyya Institute for Research and Vaccine Production in Egypt produced co-vaccine that used for protection against all types of clostridial diseases toxins. This is a picture of Covaxin 10. For ensuring vaccine effectiveness, you have to be followed the followings. Number 1, it is important to follow the manufacturer directions for storage, handling, and administration to ensure the vaccine maximum effectiveness. Number 2, keep the following in mind when purchasing and using the vaccine. Only buy vaccine which has been stored according to directions. Purchase quantities of vaccine sufficient for use on the day as vaccine deterioration overnight. Keep vaccine cool according to directions. Always carry vaccine in a cool, insulated container, removing it only for use. And the last step is follow the recommended vaccines procedures strictly to avoid carcass damage. Treatment of animals diagnosed clinically as it has clostridial disease. Treatment with antitoxin and large doses of antibiotics is expensive and not usually successful and summarized as the following. Number 1, 5 ml of antitoxin subcutaneously injected. Number 2, antibiotics, especially penicillin, orally administered for reduction the multiplication of the clostridial microorganisms. This step is too late. The most valuable step is to prevent the disease by vaccination, as described through the lecture. We're keeping you on the right track, so please subscribe the channel to reach to the most newest knowledge about the epidemiology and different infectious diseases of different species of animals. See you later.